So, as we all know, since the start of COVID-19 and the later part of 2019, we have a large toll on our communities, socially, economically, and whatnot. All the lockdowns and loss of jobs and mental issues, everything. So now all of us were waiting long for this vaccine. So that's why we are here together, and we have some experts and professionals to talk about generally about the COVID-19 and then the vaccine, which is available for us to have. So we have three people on our panel today. We have Dr. Shazia Alvi with us, a certified family physician. We have Sister Sadaf Faisal, who is a pharmacist. We have Sister Fawzia Baig, who is a region of Waterloo community engagement lead for the vaccination distribution. So we'll start with Dr. Shazia Alvi. As I mentioned, she is a certified family physician at Grandview Medical Center Family Health Team in Cambridge. She's also an assistant professor at McMaster University. Dr. Alvi completed medical school in Pakistan and did her residency in family medicine through the Rural Ontario McMaster program at Thunder Bay. Dr. Alvi has been living in Cambridge with her husband and two sons. So I welcome Dr. Shazia Alvi. Please come and let us know, give some information about maybe first about the COVID generally, and then we'll go to the vaccine.
So thank you so much for the introduction, Fawzia. Assalamu alaikum, everyone. I am really excited today to be here to give you more information about the hot topic of the day, which is really COVID vaccination. When Fawzia Baig initially asked me to do this talk, I wasn't even sure if people are going to be joining us or who would take time out of the day to get some more information about this vaccine. So it's actually really heartening to see all of you here today. I know it's a busy time of the day with dinner and kids and everything. So thank you everyone for coming and joining us today. Now, as Fawzia outlined, that our talk has a few different agendas today. The first thing that I will be talking about would be just a little bit of information about COVID-19 infection itself. Then Sadaf, our pharmacist, would talk about the vaccine, which would be, I guess, the more interesting part of the talk for all of you. And then I will come back and talk about the rollout of the vaccine and how to register for the vaccine, and Fawzia would be helping me with that part. Now, the reason for the talk today was, I think with so much information out there on the media and so much misinformation out there on the media as well, this is an opportunity to give you fact-based, transparent information. So that would help you make informed decisions and informed choices, and to address some of the questions around vaccine hesitancy and build more confidence around the vaccine, which really has not been that easy with new information about issues with vaccines coming out every day. But hopefully by the end of this talk, we will be able to answer some of those questions for you. We will try and be a little bit quick through the presentation so that we leave enough time for questions and answers. So starting with the presentation, we thought it would be a good idea to give you a little bit of an overview of the health impacts of COVID-19. I know everybody has been bombarded with information about COVID-19, so I won't go into too much detail, but I thought before we go into the vaccine information, it would be a good idea just to give you some information about how it is impacting our health in general and our society. So COVID-19 is really it's an infection with a broad spectrum of symptoms that people can develop. It can range from people being completely asymptomatic to it being fatal in a number of cases. So most of the people who would get infected with the COVID-19 would get mild symptoms, which would be viral flu-like illness, a mild kind of a pneumonia, maybe some gastric symptoms, loss of smell and taste. And those people are the people who could be managed as an outpatient. then about 15 to 20% of the people would have more severe symptoms that would include shortness of breath, low oxygen levels, and extensive involvement of the lungs. And these are the people who would require hospitalization. But then there are 5 to 6% of the people who would go on to develop critical symptoms, which is respiratory failure and multi-organ failure and multi-organ inflammation. And those are the people who are really filling up the ICUs these days. So overall, the mortality for COVID-19 is about 2.3%. But having said that, it varies depending upon the age and depending upon the underlying health conditions that you have. Most people who are over the age, if you're over the age of 80, you're 20 times more likely to die of COVID-19 as compared to a healthy 50-year-old. The other things that actually increase the chances of you having a severe disease is underlying health conditions. And these health conditions are rampant, especially in our South Asian community, which are like heart disease, diabetes, high blood pressure, obesity, chronic lung disease, chronic kidney disease, and smoking. So if you feel that you're a healthy individual and you are really not at risk for severe disease, you should think that you could still transmit the disease to somebody who's much more vulnerable and could end up in the hospital. And then we have to deal with the variants right now, which are much more contagious and can cause much more severe infections in people, which are the B117, which is the UK variant, which is 50% more likely to cause severe infection. And that is the predominant variant right now in Ontario. And then the other variant, which is the South African variant, which is more contagious, but not in terms of severity. So right now we're at a stage where there's a race between vaccines and the variants. So as soon as we can get more people vaccinated, we should be able to win the race against these variants. Can you go to the next slide, Matt? Okay. So these were the acute effects of the COVID-19 infection. But now that we're getting into the second year of dealing with this infection, we are starting to see more of the long-term effects of the COVID-19 infection as well. And the things that we're seeing is people with long-term fatigue after an infection, getting long-term cough and shortness of breath. People deal with long-term anxiety and depression. There have been cases of memory and concentration issues. So all these are long-term effects that we are seeing with some of the people after they develop a COVID infection. Now, when we talk about the long-term effects of COVID, some people say, kind of bring up a point that we do not know about the long-term effects of the COVID vaccine either. So let me clarify, when we talk about long-term effects of the vaccine, we're really talking about how long the effectiveness of the vaccine lasts. So any side effects that we expect to see with the vaccine, we should be able to see within the first 60 days. And after that, you don't really see any other side effects long-term from it. So other than the health impacts, COVID-19 has also a lot of social, financial, and mental health aspects. And getting into these is like way beyond the scope of this talk, but it all affects the burden of the disease on the society as a whole. So I thought I would share this slide with you today because this is like this is an alarming slide here. This shows that the visible minorities in the region are much more likely to be infected with COVID-19 as compared to the non-visible minorities. So this slide is from the Waterloo region. So visible minorities make up 19% of the population of the Waterloo region, but they account for 63.7% of the COVID-19 infections, which is like a staggering number because it is 3 times higher than what we would expect with the population that we have in the region. Now, there are a number of reasons that could contribute to this. Visible minorities generally belong to a lower socioeconomic group. They sometimes live in crowded houses. Multiple families live in one house. They are quite often involved in frontline work in factories and retail. So all of these do affect the infectivity in these populations, but also a part of it has to do with us. We tend to not take precautions as seriously. So now is the time for us to show our responsibility and to get vaccinated and get this infection under control. So that kind of leads me into a segue to the vaccination information itself, which I will hand it over to Sadaf to talk about the vaccines.
Before Sadaf starts, let me introduce you to Sister Sadaf. Sister Sadaf Faisal practices as a clinical pharmacist at Thames Valley Family Health Team, Woodstock. She's also an honor of St. Mary Pharmacy in Burlington. Sadaf received her Bachelor of Pharmacy from the University of Karachi, Pakistan, and completed hospital pharmacy residency. Right now, she is pursuing her PhD at University of Waterloo School of Pharmacy. Her research is focused on medication use problems in various patient populations, including older adults and people with chronic diseases, with a particular emphasis on medication management and adherence issues using various innovative technologies. So welcome, Sister Sadaf.
Thank you so much, Fauzia, for the introduction. Assalamu alaikum. Just like Shazia said, I'm really glad to see that there are so many people today, and you guys are here because you really want to know all the information. So I hope that we can answer your questions and we can put you to ease regarding the vaccine questions, which is the hot topic right now, especially after yesterday when there is another issue about one of the vaccine is going on. So I'll start my talk. Next slide, please. So for today's talk, I would like to acknowledge Dr. Kelly for the slides. These slides are prepared by her. I just updated them with some more updated information. The objective of today's talk is that we want to understand how different kind of vaccines work. In Canada right now, there are two different types of vaccines available. One is the mRNA and the second one is the viral vector vaccines. So I will be talking a little bit about both of those. We will also review the COVID-19 vaccines that are approved and then their contraindication, precautions, side effects. Next slide, please. So let's talk about mRNA vaccine, because that was a big hype when the vaccine came out, because everybody was thinking that this vaccine is going to change our DNA. So I just want to make everyone make sure these vaccines cannot and they won't change your DNA. They do not go anywhere near our DNA. There are two vaccines in this class. One is the Pfizer vaccine and the other one is the Mrna Vaccine that belong to this group. In very simple words, I would tell you that these vaccines are like the most wanted poster. So when they enter into our body, they act like that they are the most wanted poster, and then our body recognizes that COVID-19, if that's going to hit us, the body is going to start making some immunity against that COVID-19. So they are not going to change the DNA, not at all. Next slide, please. So let's talk a little bit about how do these vaccines work. So we will start at number one, which is when we inject the mRNA vaccine in our body. These vaccines don't go anywhere near your DNA, like I said. Our body cell reads that mRNA instructions and they start building the same kind of spike proteins that COVID-19 has. So our body will think that we are actually getting hit by the COVID-19, which we are not. And then our immune response will see that spike protein and it would start building a defense. And next time, if your body will get attacked by the COVID-19 vaccine, your body will already know. And then as soon as the virus will hit our body, it will start producing those antibodies and then we will not get an infection. These vaccines are very unstable. That's why it's very hard to move and they have to be kept on one location and kept it at very low temperature. So Pfizer and Moderna are the two mRNA vaccine which belongs to this group. Once the mRNA vaccine goes in our body and release that spike protein, the mRNA gets dissolved. You may feel a little bit of fatigue, a little bit of aches and pains, which is perfectly normal because that's the process how our body actually learn how to fight with the virus. Regularly in our body, every minute of every day, our body is actually using mRNA to make other proteins in our body. So mRNA is not a dangerous thing. I think that's the takeaway message I want you guys to think today, that these vaccines are not going to affect our DNA at all. Next slide. So we have two vaccines, Pfizer and the other one is Moderna. Both these vaccines require 2 doses. The time between the 2 doses depends. So for the Pfizer, it's 0 to 21 days. So you will get 1 dose and then the second dose is 3 weeks. For the Moderna, the second dose is 4 weeks, 28 days. However, because of the current supply issues in Canada, the time between two doses has been increased to up to 4 months, 3 to 4 months. So there is a National Association of Immunization who prepare those guidelines, and they have done the study, and they have actually start telling people, because we have a supply issue, it's better to have everyone vaccinated with the first dose, so all of us have some kind of immunity. That's why we are getting, if you will end up getting one of these vaccines, you may not get your second dose in 3 weeks or 4 weeks. So don't worry about that. That is normal. I got my first dose and now my second dose is due in 3 months. The reason for that, like I mentioned, it's because of the supply issues. They don't want people who have 2 doses, but then a bunch of people who have no doses at all. So we want at least some immunity, some kind of protection that we will receive when we will have our first dose. For most of the other vaccines that have been developed so far, the delay between 2 doses do not reduce how well the vaccine work. In general, so you shouldn't be concerned about that delay. It will take some time for your body to build that protection once you have received the vaccine. Since the clinical trials usually, especially for this vaccine, the clinical trials happened very rapidly. So they had to do a 3-week second dose booster just to make sure that there was some kind of immunity coming up. But this time frame has nothing to do with the boosted immunity, that you will feel that if I will not get my dose in 3 weeks, I may not be protected as much as I'm supposed to be. The Pfizer is approved for patients age 16 and over, and Moderna is for 18 plus. They didn't have any participants in their trials who were under the age of 18 and 16 for these 2 vaccines. That's why they did not approve it in children. But then now there are more trials happening right now where they are conducted between the age of 12 and 16. And the last one that I found out was from the children age of 6 months and over. So soon our children will be able to get the vaccine just like all of us. Next slide, please. So how effective these vaccines are. So the Pfizer vaccine, the largest trial that happened included 40,000 plus participants, and they found out that 95% protection from having the disease. So I want you guys to consider 2 different options here. So there is one option, which is having the disease, where you can get, like Shazia said, mild symptoms, which is flu-like symptoms. You may get stomach upset, and then a little bit symptoms which include the shortness of breath, right? That is what you get when you have the disease. And then there is another thing, which is going into the hospitalization, being intubated in the ICU. So these vaccines are approximately 95% protection for an individual having the disease. They have similar efficacy in race or ethnicities because the participant populations included all kind of race. They used all age groups. So diversity in population and efficacy was same all across the board. So it's not that people who are white, it will be more effective on them, or certain diseases, they work better in South Asian community or in Asian communities. They have similar efficacy with all kind of race, ethnicity, and age. Next slide, please. So what about allergies? A lot of people ask this question, that if you have allergy, what am I supposed to do? So the first and foremost important thing is that when you will go and get your injection, they will have it in a setting where staff can manage severe allergies. They usually ask you to sit in that setting for approximately 15 minutes because the allergic reaction usually happen very quick. So they will ask you to sit over there and wait for 15 minutes, and then they will let you go. So people who have allergies to a previous flu vaccine, they can still get this vaccines because this vaccine is totally different than the flu vaccine. So if you had a flu vaccine allergy in the past, you're still safe to get this vaccine. You just have to let the healthcare worker know who is injecting you. They probably will ask you to wait for 30 minutes instead of 15 minutes, just to make sure that nothing happened. Another important thing that I want to tell people is that Pfizer had an incidence of Bell's palsy. So Bell's palsy is a problem where usually one side of our face or the body muscles stop working. There is the studies that have shown that there is a temporary facial paralysis, the direct relation between Pfizer and Bell's palsy is not being established. Their study has 38,000 patients and they found only 4 cases of Bell's palsy. And keeping in that, they said that there may be more kind of underlying problems that can happen. But if you had any kind of that concerns, feel free to talk to your pharmacist, your family doctor, or even when you go to get your injection, let them know that I am a little worried about it. They will probably make sure that you stay over there and then you wait for any symptoms. And they will also ask you to let them know if you feel, when you go home, if you feel any kind of side effects. Next slide, please. So those were one kind of vaccines. The second type of vaccines are the viral vector vaccines. What these kind of vaccines actually use a safe virus and they carry a little bit of COVID-2 and they teach our body how to recognize it. So those vaccines are called viral vector vaccines. Next slide. So how do these vaccines work? So these vaccines, we will start with number 1. So scientists make harmless adenovirus, which deliver a short genetic code to your cell. So what are adenovirus? Adenovirus are usually the virus that cause cold. So what scientists do is that in their lab, they take those virus and they make them harmless. So once they are harmless, they're not going to cause any kind of cold. Then those virus will contain a little bit of that COVID-19 protein and they will inject it into your body. Once that is in your body will see that and start generating the same kind of spike protein as a COVID-19 infection would. And that's how your immunity will develop. Similar to the mRNA vaccine, you may feel a little bit of fatigue, ache, or fever at that point. And that is because your body is recognizing that spike protein and it starts making the immunity. Next slide, please. So in this class, we have 2 vaccines, AstraZeneca and Johnson & Johnson. AstraZeneca required 2 doses. One is when you get a 1 dose, the second dose is usually between 4 to 12 weeks, and Johnson & Johnson is only a single dose. Johnson & Johnson is just recently got approved in by Health Canada, so it is coming as a supply coming for the injection. AstraZeneca is in the news since they developed the vaccine. Recently, yesterday actually, NACI has updated their guidelines and they are recommending that people who are under the age of 55, they are not giving them AstraZeneca vaccine anymore. The reason for that is that they had in Europe, the study that was happening, they saw that people, especially women under the age of 50, they had some blood clots, and that's why they are not sure that if it's still safe to do in that population. So just, I don't think that any of you will, if you are under the age of 55, any of you will get an AstraZeneca vaccine, but make sure to talk to your pharmacist or your family doctor if you have any question. People who are older than 55, they are safe to use AstraZeneca vaccine. When it got approved in Canada at that time, they did not have any data for people who are 60 or older, but right now they got a big study data came out and it is safe in seniors. So anybody who's the age of greater than 55 will be can safely get AstraZeneca. Next slide, please. So both these vaccines, Johnson & Johnson and AstraZeneca, they are, like I told you guys before, there is one thing of having illness and there is another thing of having severe illness, hospitalization, and death. Both this vaccine give you 100% protection from severe illness, hospitalization, and death. And they have 60 to 80% protection from any illness. A lot of people are comparing that Pfizer is 95% effective, but AstraZeneca is 79% effective. I'm gonna get Pfizer because that's gonna give me more protection. My recommendation to everyone is don't wait for the vaccine that you want to get the vaccine that is available because you will still get some kind of immunity. All 4 vaccines will give you protection from severe illness, hospitalization, and death. We don't worry about when we get COVID for those mild symptoms, right? Like those are the mild flu-like symptoms. They usually, if our immunity is good, if we don't have any underlying disease, if we are not senior, if we don't have any comorbid conditions, our body will actually recover. It's more for those people if you end up in the hospital. So you are right now want to protect yourself from ending up in the hospital. So get whatever vaccine is available through your health unit or through your pharmacy or through the designated site. For over the age of 65, for AstraZeneca, they had uncertain efficacy, but yesterday there was a big trial that happened in US, and they said that 79% of people were actually, it was actually effective, and that pool of patients were all ages. So they did no longer recommend that it's only for people who are under the age of 65. Next slide, please. So let's talk a little bit about what are the contraindication and precaution for COVID vaccine. So if you have a previous confirmed allergy to a vaccine dose or to a vaccine, if you will get one dose of vaccine and you will get allergy from that dose, you will not get a second dose. So if you get a Pfizer, Moderna, Johnson & Johnson or AstraZeneca first dose and you will get allergy, you will not get the second dose. However, like I told you guys before, if you had an allergy to flu vaccine, that is not a contraindication to COVID vaccine. You can still get the COVID vaccine. People who are acutely ill individuals, so for example, if you had a fever, they might ask you to wait for 14 days because they want to make sure that your body is in a good shape to build the immunity from the vaccine, from that virus that we are giving you in terms of the vaccine, not with anything else. So if you had a fever or something like, you may have to wait for another 14 days. Pfizer and Moderna, they both contain just one potential allergen, which is polyethylene glycol, which is very common in a lot of over-the-counter medication. Even Benadryl has that. A lot of laxative like Restore-Lex and Lexaday, prescription medication, even cosmetics and skincare products. So you won't get allergy from Pfizer or Moderna unless you are really allergic to one of that specific components. So just keep that in mind. Any of the other two, they simply have like ingredients that are, especially the mRNA vaccine, they simply has salt, water, and a little bit of polyethylene glycol. So there is not a lot of potential allergen in these vaccines that can affect your health or that can actually make you allergic to the vaccine. Second slide, please. So as your immune system learns from the COVID vaccine, like I told you guys before, you may have a little bit of fatigue, headache, a little bit of muscle pain, chills. Maybe you will feel a little bit of like, bad for a short time, but that is because your body is now working against that spike protein and it's developing that immunity. I don't know what percentage of you get the flu shot, but a lot of the time when we get flu shot every year, like after the flu shot for 2-3 days, we usually feel a little achy, which is perfectly normal with this vaccine too. Next slide, please. So what should I remember from the side effect of these vaccines? A lot of people talk about the side effect of the vaccine. I just have a couple of numbers. So 8 in 10 people, they will complain about sore arm, but only 1 in 100 will say that the soreness was severe. So when I got my vaccine, I had a sore arm for 24 hours, but then after 24 hours, it was gone. 5 out of 10 people will complain of fatigue and headache, but only 1 in 10 will need Advil or Tylenol. And these side effects, like I said before, they are mostly because of an expected immune response that our body will generate, and they are very mild and easily manageable. So if you end up having any kind of headache or chills or having a little bit of a body pain, take whatever you take after you get a flu shot. So some people can take Advil, some people can take Tylenol. Just make sure that it doesn't interact with any of your other medications, but just treat it like you got a flu shot. Next slide, please. So as of 29 March, that was yesterday, over 5 million doses have been administered in Canada. In Ontario, you see that block over here, 8.32% of Ontarian population has been administered vaccine. The numbers are not still very good, so we all need to go and get vaccinated as soon as our turn is there. Next slide, please. Now I'm going to spend a couple of time. I have only 3 slides left. So let's just talk a couple of questions that I have been receiving a lot. So first question that a lot of people ask is that, how were these vaccines developed so fast? So usually when a drug's coming to the market, it takes behind the all that process, it usually takes 6 to 8 years for a drugs to come. If the company really want to bring something in the market, and if they really need a medication, usually 3 years. But people ask a lot of the times that how come the vaccine just got developed so quickly? So did they not do enough trial? But these are the vaccines that, because the pandemic hit globally, so the global funding was available, and because of that global funding, the process of developing the vaccine got way faster than as compared to something else. The second question, like I have said many times, mRNA vaccine can change my DNA. They can't. And they are simply a message that goes to our body to tell our body that there is a COVID-19 virus, and our body will start making immunity against that virus. It will not change any of our DNA. Are the ingredients in the mRNA vaccine safe? Yes, they are free of preservative. There are no preservative in Pfizer and Moderna. They usually just use an mRNA, which is like a cholesterol coating. So like an oil coating around that virus, and they have salt, sugar, water, and polyethylene glycol. There are no blood products. There are no fetal cell in mRNA vaccines. What kind of long-term data do we still need? That's a really good question that a lot of people ask. And it is true, we do need long-term data, but clinical trials have showed us that vaccines are safe. Now we want to wait for the long-term data because we want to know that how long that vaccine will protect us. So like, for example, flu vaccine, right? We need to get every year flu vaccine because the flu vaccine that we get only protect us for certain time. So we are now waiting to find out how long we will have that protection. Do we need to get COVID vaccine every year? Is it going to come back like that, or do we just need one dose? Next slide, please. For the viral vector, this is the AstraZeneca vaccine and the Johnson & Johnson. So these are the viral vector vaccine. Like I said, they teach our body how to make COVID-19 by using a harmless adenovirus, and our body recognize that and then just start producing those spike proteins. They are very effective. They reduce the severe COVID symptoms, hospitalization, death, and may allow us to end the lockdown sooner. So don't wait that if they are not giving you Pfizer or Moderna, you don't want to get these vaccines. If they are available, they are as effective as the other two vaccines. The ingredient in these vaccines, they are very safe. They have salt, sugar, water, and medical grade alcohol. There is no blood products, there is no animal products, and there is no fetal tissues. What kind of long-term data? So same thing that they have, as of February 2021, 15 million people have safely had AstraZeneca vaccine in UK. And now we are waiting for long-term data. And like I said, they got a data yesterday that said it's not safe in under 55. So now they are trying to tell people don't get AstraZeneca under the age of 55. So wait for those news. Health Canada is doing a very good job in updating all of us. They are developing their policies and they are stopping the places where they already have AstraZeneca vaccines. They have actually told them not to administer. So when you register, they ask for your date of birth. So they will match you with the right vaccine. They will not give you AstraZeneca vaccine if you are under the age of 55. Next slide, please. So vaccines are safe, effective, and they're the best way to protect you and those who are around us. I got my vaccine. I hope everyone else get their vaccine as soon as we can so we can go back to whatever normal we can. And thank you so much. And if you guys have any questions, feel free to ask. I'll try my best to answer them.
Okay, so first, I think at this point, we are going to Sister Fauzia. Or Dr. Shazia, do you have a few more slides?
Sure. Yeah, no, this is what I will be doing this part, and then maybe Fauzia will do something at the end.
Okay.
So thank you so much for all this information, Sadaf. That was really helpful. And now that you guys have all the information you need about the vaccine, let's just talk about how to go about getting the vaccine in the Waterloo region and where we are with the rollout process. So really briefly, I'll touch base on how the vaccines make it to our region. So first of all, the vaccines have to be approved by the federal government. Now, the federal government itself doesn't approve the vaccine. It has to take recommendations from NACI, which is the National Advisory Committee on Immunizations, about the safety of vaccine. And after the recommendations, they're approved, and then they're procured from these other countries to be distributed to other provinces. And that is where the backlog has been in terms of getting the vaccines into people's arms, because we don't have a homegrown Canadian vaccine yet. So we have to wait for the supply from other countries. So now that the supply is picking up, hopefully we'll be able to vaccinate much more people much more quickly. Once the federal government gets the vaccines, they send it out to the provincial governments. So once Ontario gets a vaccine, Ontario is responsible for prioritizing who gets the vaccine and when they get the vaccine. And then they distribute it to the local health networks. And that's how Waterloo Region gets the vaccine. And once Waterloo Region gets the vaccine, then they're responsible for setting up the local clinics and getting the vaccines into people's arms. So the Ontario's vaccine plan for the rollout has 3 main phases. Now, when you look at these slides, these phases do not have definite endpoints. So the first phase kind of already started back in December, and it's still ongoing, but the phase 2 has started along with the phase 1 and is now ramping up quickly. So the phase 1 was targeted at the highest risk populations that started in December. That included the seniors that are living in long-term cares or in retirement homes, all the frontline healthcare workers, adults that belong to First Nations, adults who were receiving chronic home care, and adults over the age of 80. So those were the highest risk population, and that went from December, and it is actually still ongoing. Phase 2, it belongs to high-risk populations again, which started actually in March and not in April, as the slide says. And that includes all the adults between the ages of 60 to 79. It says in Ontario that it will be in 5-year increments, but in Waterloo Region, we're actually going a little bit faster, and we're doing it in 10-year increments. So it was, the registration was open for people over the age of 70, but as of just today, hot off the press, it is now open for people over the age of 60. And other than those people that are over the age of 60, it is also open for people who are in other high-risk settings like shelters and community living groups. Also people who have certain high-risk chronic conditions and their caregivers. I will talk about this briefly in the next slide as to what high-risk conditions are now eligible to get the vaccine. And then the phase 3, it says July onwards, but really we're hoping that the phase 3 we will be able to complete by the end of June if the vaccine supply continues the way it is now. So this would include everybody under the age of 59 and who does not belong to any of the higher risk groups. So the clinic locations that we have currently are listed here on this slide. So the biggest location right now in the Waterloo region is actually in Cambridge, and this is the Cambridge Pine Bush Clinic. It is open 7 days a week. We currently have 25 immunizers there, but the plan is to ramp it up to 40 immunizers to be able to do 4,000 vaccinations a day in that clinic. Other than that, the Lang site in Cambridge is open right now. There were some potential change in that site to another area, but right now I think that's going to be running for a little bit more. Then there are other vaccination clinics that are listed here in the Waterloo and Kitchener area. Along with that, there are mobile teams that are going to the senior apartments and senior retirement homes and long-term care homes. In people who live at home that are unable to make it to the vaccination center, they are elderly or housebound for some other reason, the region is in touch with certain third parties to figure out how to get the vaccines to them. The only issue with the mRNA vaccines are that they're really fragile and they have to be kept at really low temperature, so their transportation is an issue, so that is being figured out. In terms of pharmacies, there is a pilot project that is going on in certain parts of Ontario right now, and if that works out, then it will be rolled out to other parts of the province as well, and we will find out if it comes to the Waterloo region. But currently, there is no pharmacies in the Waterloo region who are administering the vaccine. So now that the pre-registration is open, I will take you through the steps of how to actually go about registering for the vaccine and how to get your vaccine and book your appointment. So the priority groups who are eligible for pre-registration now are adult recipients of chronic home care, so who are getting like LIN services or nursing services and live at home chronically. Adults over the age of 60 who were born in 1961 or earlier, so this change just started today, they can now go ahead and pre-register. All healthcare workers, whether they're pharmacists, physiotherapists, massage therapists, all of them can get their vaccinations now. Indigenous adults, people who are living or who is the staff in essential caregivers in retirement homes and group settings, adults with high risk and the highest risk conditions, which I will just list which conditions those are in the next slide, they can get the vaccine as well. And then one essential caregiver for the high-risk individuals can get the vaccine as well. So that essential caregiver has to be responsible for helping this high-risk individual with their day-to-day activities. So you should note that this essential caregiver has to pre-register themselves for the vaccine as well. They can't really show up with the high-risk person to get the vaccine on the vaccination day. So they just have to pre-register for themselves as well. Now, in people who have other high-risk underlying conditions, they do not need a proof of their condition from their doctor or a letter from their doctor. It's just based on an honor system. So they would be asked some questions at the vaccination site, but they do not need to take any proof with them from the doctor's office about their underlying medical condition. So the high-risk conditions that are eligible to get the vaccine now are organ transplant recipients, stem cell transplant recipients, people who have certain neurological disease that can affect their lung function, like multiple sclerosis and myasthenia gravis. If you have a blood malignancy that was diagnosed less than a year ago, if you have end-stage kidney disease, that means that your kidney function, the eGFR, which is less than 30, which is like severe kidney disease. Obesity is another condition which those people can get vaccinated if they have a BMI of more than 40. People who are on immune suppressive treatment like chemotherapy, people who have intellectual and developmental disabilities like Downs or autism, they can also get their vaccines. They can pre-register for the vaccine now. So for pre-registering for the vaccine in the region of Waterloo, we're not going through the Ontario portal. We have our own portal. So the website is listed here. So even if you just Google region of Waterloo COVID vaccine pre-registration, it should take you to this portal. Before you pre-register, the information you need will be your contact information, including your address, your email address, or a mobile number that can receive a text. So those are preferred methods of contact. If you do not have your own, you please consider asking someone that you trust to complete the pre-registration on your behalf, and you can use their email or their text number. But if you don't have any of those, then you can give your landline as the contact information. But if you use the landline, then it may take 4 to 6 weeks for them to contact you because it's not auto-generated then. And you just have to make sure that you belong to one of the priority groups before you pre-register. If someone doesn't have any access to a computer or internet and cannot access this website, they can always call the telephone for the public health and they will help you get through the registration process. But just be aware that it is a long wait time on those phones these days. So if you can register to the website, that would be the easiest way to do it. So once you go onto the Region of Waterloo pre-registration website, this is the page that you will see. The green box is the box that you need to click on to open up the pre-registration form. If you have any concerns or you're unsure about how to fill out this form, this red encircled video presentation link will take you to a video presentation that will show you how to pre-register and how to fill out these forms. If you have any trouble reading or writing English, then there is a translate button at the top, and that can translate into a number of different languages that can help you with the registration process. So once you open up the form, it's really pretty easy to fill out the form, and then you hit submit. Once you hit submit and you pre-register, that does not mean that you have an appointment. And it does not mean that you will immediately be contacted for an appointment. You will be contacted for the appointment when the vaccine is available for your priority group. The way they will contact you will be by email or text or whatever way you chose on the form that you submitted. That will have a link on how to actually book the appointment and where to book the appointment. So on the day, so once you select the, your location of the appointment and the date of the appointment, on the day of your vaccination, you have to make sure that you bring your identification on the day of your appointment, preferably a health card, but you could take a different identification with you as well. Plan to arrive not more than 10 minutes earlier than what your appointment time is, because they want to avoid overcrowding and long lines. You may bring one person to your appointment if you need for like physical assistance or for translation, but if you don't need the support person, it's better to attend by yourself. Be sure to wear something that gives you privacy when getting vaccinated, but make sure that your upper arm is accessible, that you don't wear anything that's too tight. If it's a half sleeve or something that doesn't have a sleeve that you wear underneath, that will be easy accessible for the arm. That really helps with the vaccination appointment. So after you receive your vaccination, you will be required to wait for 15 minutes for most of the people. If you have any issues with allergies in the past, you may be required to wait for 30 minutes. And at the checkout, you will be given the appointment for your second dose. So they will automatically generate and tell you when you're supposed to come for your second appointment. You would be getting a reminder about the second appointment too before your appointment. Even after you're fully vaccinated, it is really important you continue to follow public health measures and guidelines until we develop herd immunity and most of the people get vaccinated and the guidelines change from the province and the region. We still have to make sure that you follow physical distance and then wearing masks. It doesn't mean that you have like a free passport to do anything, whatever you want to do. So this is the picture of me with my dad after he got vaccinated. So I thought I would just share the story of how easy it was to get my dad vaccinated. The pre-registration form was simple to fill out. We got the email to fill out the appointment form. And then at the appointment time on the vaccination clinic, it took us less than 45 minutes, like total time to get in and out of the center. I should also mention that I did get my mother-in-law vaccinated as well. And I should mention that my mother-in-law is not a citizen or a permanent resident of Canada. She is here on a visit visa. So people who are on visit visas, and if they're here with you, they are also eligible to get this vaccine at no cost. You have to pre-register them as well and make their appointment. And on the day of the appointment, you have to make sure that you have to take some form of valid identification. So I took my mother-in-law's passport, and that was enough to get her vaccinated. And that is all the information I had to share with you guys today.
I think that's good. Thank you so much, Shazia, for doing such a great job. You took care of the information that I was going to share as well. So, and you did a fantastic job, even better than I could have done. So thank you for that. Here's the website for the region of Waterloo, where all of our COVID information is. It's actually the best source of information in terms of the most up-to-date. So if you're looking for information, I would say go to our website at COVID-19 Vaccine to find that out. I think that's the end of our presentation. We just want to open it up to questions. If there's any questions from anyone in the audience in terms of the vaccine safety, or for Dr. Shazia or Dr. Sadaf, please, this would be the time to ask.
Okay, thank you to all of you, our panelists. It was much more information provided, what I was expecting, and maybe most of us were expecting. Thank you for that. And the last thing to know, that visitors are getting it free of cost. That was wonderful. Okay, so for question and answers, please raise your hands, and then we'll allow you to unmute yourself and you can ask your question. So Sister Sania, please go ahead.
I think she's still on mute.
Oh, can you hear me now?
Now we can.
Okay, so my question is basically, if you have if you're taking a certain medicine that you're taking, you have to take it basically. So how does it work for the vaccine? There's no research or no study done yet how it's gonna go with your medication that you're currently taking.
So currently, I think I recognize you, Sanya. So currently, the big concern really is being on an immune suppressant. So if you are on an immune suppressant, then what it does is it affects the effectiveness of the vaccination, really. So you might not get a good immune response to it. So most of the rheumatological association is the big association that deals with people who are on immune suppressants. So most of the associations recommend that you should still go ahead and get the vaccine, even if you have a rheumatological condition. But there are certain injectables or certain immune suppressants that might be put on hold depending on which medication you are. So it would be best to talk to your specialist before, if you are on certain special medications, before you actually get the vaccine. I don't know if something to add to that, Sadaf. Oh,
You're on mute, Sadaf. We cannot hear you.
Sorry. Can you hear me now?
Yep.
So yeah, so as far as the drug interaction comes, so basically when we take two drugs together, we are worried about that they may kind of counteract each other. So that's the biggest worry, and they may not work well. Like Shazia said, that for immunosuppressant medications, your vaccine may not be as effective as for you, but you will still have some kind of immunity. So that's the message that I'm telling everyone, that at least you will at least have some kind of immunity. There are no studies happened so far that have identified any kind of drug interaction or people who were in those trials. Whatever medications they were taking, that data has not been disclosed. So we are still waiting for that data. But unless you are really on immunomodulator or any kind of immunoantibodies, those kind of medications, it's safe to take vaccines, other prescription medications.
Okay, great. Thank you. Because I had the same question with my specialist too. And they said there's no studies done, but it's good for you to take them. Nothing is like said that you cannot take them. It's good to take them. So I just wanted to see what are the thoughts for other doctors, and as Dr. Shazia Alvi is my doctor too. So I just wanted to ask her this question.
Thank you, Sanya. I just want to say that I am monitoring the people who have raised their hands, and I'm putting in chat the numbers just so I don't miss it. So keep an eye on your number. And then please unmute yourself.
Sure.
And then after you ask the question, if you could kindly mute back, that would be great, just so we don't have distractions. Thank you, everybody.
So, Afroz?
Yeah, Assalamu alaikum, everybody. Mashallah, it's a very wonderful program and it's very informative. Jazakallah khair for doing this. My question is, I know you did say about the wait between the two vaccinations, but I would like to ask is it effective? Because that's what I heard, that if it delays, then it's not so effective. You know, again, that was one of my concern with senior citizens like my father. He's going to get his vaccination. So between the two vaccinations, if there is delay, earlier it was said that there is 3 weeks, but now during this presentation, I did hear her saying that it will be longer, maybe a few months. So that is quite concern for me. If you can elaborate on that, please.
Sure, yeah. So that's a very good question, Afroz. So yes, so the delay between the two doses. So like you said, your father is like a senior, and seniors are mostly because they usually have like a couple of chronic conditions. So they are recommending that people who are senior or who has multiple comorbid conditions, the gap between the two doses should not be that long. And Health Canada is working on approving, and then there is that supply chain issue. And now AstraZeneca has came up with that it is safe in 65 and older. So I'm hoping that they will revisit the same thing. The thing with the between two doses is that the second dose usually will gives you the data about how long. So the trials that they did, because the clinical trial they had to do in a hurry because they wanted to bring something out for the immunity for the global pandemic. Usually the two doses between for the vaccines usually are not this close together. So they usually, so for example, if you do a Hep vaccines, it's usually 0, 2 months, and then 6 months, right? So you are getting the third vaccines after 4, 5, 6 months. So they had to come up with the shorter duration because it was a clinical trial. But the recent recommendation that came out is that for people who are seniors, they are actually considering that the gap between the 2 doses should not be that long. Right now, the gap between the second dose is about 12 weeks, which is like 3 months. But I'm hoping that because we will solve the supply issue soon, and then that gap will be shortened.
Can I add to that as well? Just because, so at Public Health, what they're doing now is that they've identified for which conditions, like Sadaf is saying, that the doses need to be closer. So when you go in and when you take your father in, he'll get his first shot, and then they'll ask you a set of questions if you have any of these conditions. And if you do, then your second shot will be booked closer than the 4 months. So they actually have started to work out that process. When you go get your shot, they will figure that out with you if you need to have your shot closer. But like Sadaf said, that the efficacy of the vaccine doesn't decrease for anyone else because you're getting it 12 weeks apart as opposed to the 6 weeks initially that it was, or the 3 weeks that it was.
Yeah, I just wanted to add to that, just the rationale behind the 4-month wait time is that sometimes in the middle of a pandemic, you have to make urgent decisions and see what's best for the population as a whole. So it was best to get as many people vaccinated with at least 1 dose rather than waiting for just for other people to get 2 doses and then half the population has no dose at all. So just kind of that was the rationale behind spacing it out.
Okay, next is Madiha.
Assalamu alaikum. Thank you for such a wonderful session, and it's quite informative. My question is regarding skin problem psoriasis. If you have a psoriasis and you are taking medications, so it is safe to take a vaccine, because I saw some reports regarding skin, if you have a skin problem, it making the vaccine making it worse. So is it safe?
So generally, the only contraindication to the vaccine is if you've had a severe allergic reaction to the COVID vaccine in the past or one of its components. All these other conditions, it is still recommended that you go ahead and take the vaccine. There might not have been enough studies specifically in people with psoriasis with this injection, but certainly there haven't been enough studies with this injection in pregnant women, but they're still recommended that it's better to get the vaccine and get yourself protected. So there's no studies that I'm aware of that show that this worsens the psoriasis condition as such. But if you are on medication, some sort of an immune suppressant medication for psoriasis, it may decrease the effectiveness of the medication a little bit, but it's still recommended that you go ahead and get that.
Thank you.
Next is Sana.
Hi everybody. Can you hear me now?
Yes.
Yeah.
Yes. Hi everyone. Thank you so much for sharing the important information. My question is just, I'm talking about my husband. His immune system is very weak. Like most of the time he's sick, he had cold, flu, something like that. And he's taking over-the-shelf medication, and he's already taking a lot of medication about depression or something. He had stomach problem. So he always on medication. So I'm just wondering, it is safe for him, or there is a chance to get side effect more or something like that?
So no, Sana, if he is immunocompromised, if he's getting a lot of cold and flus already, I think he should go and get vaccination. Vaccine does not interact with any of the prescription or over-the-counter medication. The only thing is that if you will have a fever 14 days prior, so they will want him to wait for 14 days. So for example, if he just had a fever, they may ask you, do you have any fever within the last 14 days? And if he said yes, they will ask him to wait, just because if he will go with a fever, the vaccine might not work. Like our body will not know if the body should fight with the virus or the body would fight with the fever. But if he is an immunocompromised, if he is taking medication, like if he has those comorbid conditions, the vaccine will prevent him from ending up into the hospital or having severe shortness of breath, God forbid, any kind of intubation or that sort of a thing. So I would highly recommend him to go and get the vaccination.
Okay, so he is going on the priority list or no? I don't know about that one. Like the priority list, is he going there or no, he has to wait? Like he's around between 45 to 50 years old.
So if he has any of the underlying conditions that are listed in the priority list, so if you go on to the Region of Waterloo's website for COVID pre-registration, it lists all the conditions that that he would that would qualify for as a priority. So if he qualifies for any of these, then he would be on the priority. But if he doesn't have any of those underlying conditions, then he has to wait.
Okay. Okay. Thank you so much.
Next we have is Omar.
Yeah, my question is there, since the safety studies are not complete yet, and I think you touched on this because it was rushed out for, urgent circumstances, is there a history of mRNA vaccines working well?
So
has this been done before?
Sorry, yes. So mRNA vaccine is not a new vaccine for COVID. They had mRNA vaccine previously, which have been worked. So it's not something which is a new technology. They have been working on it for a very long time. They are working on a lot of HIV medications that are based on the mRNA, the same technology. They are working on a lot of medications that help with the immunocompromised individuals. So mRNA is not a new concept that they just came up with the COVID-19, and there has been a safety data available for those medications.
Yeah, that's factually incorrect, just so you know. There is no mRNA vaccine prior to this batch of vaccines that were started in 2020. No successful launch of an mRNA vaccine. If you can point to the name, I think that would be helpful, of any vaccine that was put to market.
Sorry,
any
no,
mRNA vaccine.
I'm not talking about mRNA vaccines. I'm talking about
the technology is not, that's not the issue. There's all sorts of R&D. That's not what we inject into ourselves. Do you have any information about a successful launch to market of an mRNA vaccine in the world?
No, there has not been any mRNA vaccine that has been used before. They have used the mRNA technology for the other medications, but not for the vaccines.
Yeah, so that should temper some of the recommendations, especially when you're talking about safety and interactions. I would think that should temper some of the recommendations coming from this panel. The safety studies are not done, and this is new technology brought to market that's being injected into people. So it's something to consider.
Sure. So yeah, in terms of like when we're talking about safety, when we're talking about, I don't know, I touched base on it briefly. When we're looking at side effects for vaccines and stuff, safety data, we generally kind of monitor for like 60 days or so. After that, the long term, there are really no safety issues. There efficacy that is kind of studied long term, but not safety. So it is kind of studied for the 60-day safety data. So it is generally safe to take.
Okay, next we have in line is Sharika.
Hi, assalamu alaikum everyone. Thank you very much, everyone, for arranging such a good workshop. My mom is sitting with me and she has one question she needs to ask that.
Hi, assalamu alaikum. Me and my husband suffered from coronavirus last January 3rd week till the February mid. I just wanted to know, he's 80 plus and I'm 70 plus. I just wanted to find out if it is still essential for us to get the vaccination done, or we don't need it anymore.
Sure. So that's a really good question, actually. So if you do get the COVID infection, you will get some immunity, but that immunity is short-lived. It may last only for a few months. So it is still recommended that even if you've had the infection, that you still go ahead and get the vaccine. Once your acute illness is over and you're out of your isolation period, then it is recommended that you go ahead and get your vaccine. Because for long-term protection, you would still need the vaccine. Natural immunity would not provide long-term protection.
Okay.
Thank you very much for the information. It's a very beneficial, informative session. Thanks a lot for everyone. God bless you.
You're welcome. I don't see Shamim Alam anymore. Hands up. So next is Abdul H.
Yeah, assalamu alaikum. Thank you for such a great session on vaccine information. I just wanted to ask, between the mRNA and the adenovirus vaccines, is there a difference of side effects?
So no, the side effects are pretty much same for both the vaccine, because both vaccine produce the same kind of response when they enter into the body, that they want our body to generate the spike proteins that are similar to a COVID-19 infection. So the same side effects you will get, which is like fatigue, pain in body, a little bit of chill. You may feel like a little bit of a headache, but it's pretty similar with both type of vaccines.
Okay, next we have Lisa.
Hi, I just had a question. So for the final group, when they say everybody is going to be vaccinated, hopefully by June or July, does that include children and teenagers?
No, sorry. Shazia, were you about to say something?
Yeah, I was just going to say it will be people between the ages of, like, up to the ages of 18. Really.
Yeah, for Pfizer, and it's 18 plus, and for it's like 16 plus for one of them. But the children who are under 16, they're still doing the studies. Hopefully we will have data by summer, and if the data is there that shows the safety, then our children might be able to get. The two trials that are happening right now, one has children which are from ages of 12 and older, and the other one actually has children who are 6 months and older.
So if you have like 17-year-olds, are they prioritizing that one vaccine that is for above 16, or are they holding off on the high school kids?
If they are 16 plus, they if it's a 17-year-old, they might get Pfizer, but if they are 18 plus, they may get Pfizer or Moderna, whatever is available. But then if they are 17-year-old, they can only get Pfizer, because that's the only one that is safe in children, or they had clinical trials that were happened in ages of 16 plus.
Okay. And can you just clarify too, I didn't see it anywhere on the list. So people with diabetes are not, like, they're just in the phase 3. They're not in the phase 2.
They will be in phase 2, but phase 2 is still ongoing. So they just open it up for the highest risk phase 2 with these kind of cancers and underlying health conditions. The next phase, just keep tuned. They will be opening it up for people with diabetes, hypertension, heart disease, and all these chronic kidney disease.
Okay.
But it will be phase 2.
It will be phase 2 just later on. You're not part of the pre-registration process yet, but maybe soon. Okay. And sorry to ask, I have so many questions, but just if you have some, like, I have a friend who has like severe, like, shellfish, like, allergy, and I have a friend whose parents have like blood clotting issues, and, you know, so they're really hesitant about taking the vaccine. Like, who would you recommend they talk to get, you know, reassurance that it's okay to have the vaccines done? Because just, you know, a friend or family member, that's probably not going to cut it, but they probably should get the vaccine. So should they call their doctor, or what should they do?
So talk to your doctor or talk to your pharmacist, whoever is available, because they can give you the information about allergies. Usually these medications don't have a lot of ingredients. These vaccines, they only have salt water. And like I told you, there is polyethylene glycol in the mRNA vaccine, and the other vaccine has a medicinal grade alcohol. So if you have a shellfish allergy or other kind of allergies, it shouldn't interact. But just for for your mind ease, I would recommend tell them to talk to the doctor or talk to their local pharmacist and just find out, and they can specifically tell you what the ingredient the medications have, these vaccines have.
Okay.
Next we have Suman.
First, yes, just 1 second. If anybody have questions that you would like to type in the chat, you're welcome to do that, and I will read out the questions to our panelists. Thank you.
Hi, I just had a question regarding the duration of the vaccine. I don't know if the data has gotten this far, but do you know if it offers lifelong immunity or if it's just temporary?
we don't know that. We are still waiting for the long-term data. So that's why they are, because right now we just know that they produce some kind of immunity, which is like different for different vaccines. But how long that immunity is going to stay in our body, we don't know that yet. Usually those kind of studies take longer. So we should have like year-long data to at least know. And then we will know if we need to get vaccinated every year or if we need to just get vaccinated once and the booster will be in 10 years or something like that.
Yeah, fair enough. Thank you.
So we have one question in our chat that's about the vaccines being halal. I think you already mentioned that there are no fetal cells in any of these vaccines. So that answers it. But like anything else, as Muslims, we need to know about these vaccines being halal.
There is no gelatin. There is no. Sorry, Shazia, go ahead.
Yeah, go ahead. There's no gelatin. There's no pork product. There's no blood product. There's no animal products whatsoever. So they're completely halal to take.
I just want to add, I think Omar had a question about the fetal cell lines. We've gotten that question before. We can send a written response if that might be easier. If Omar wants to provide an email address, then we can provide a more detailed response to that. But we've gotten that question before.
Is your response going to be that there isn't a fetal cell line component to the ingredients?
Yeah, it'll explain like what that is about, like where the
that's not accurate. That's not accurate. It's literally right on the vaccine insert. If you read the AstraZeneca vaccine insert, for one example, there's multiple examples. It says the HEK293 ingredient component listed. It's in plain English.
So if you give us an opportunity, we can provide you with a more fulsome response than what we can give you right here, right now. So I would say that is an important question, and I'm glad that you asked it. And that if you give us your email, and it may be that the Muslim Women of Cambridge can share it out to everyone else too, once we send that written response.
The response is why I asked up front. If the response is that it does not, then there's no point in you emailing me that, because I know that it does, and anybody can verify that themselves. So you should perhaps familiarize yourself with that. That's just one. I'm just asking about AstraZeneca. I'm not asking about Pfizer or something. If someone knows that there's an ingredient, there's a vaccine that doesn't contain any component of fetal cell line, and I'm stressing line ingredients, then I'd like to hear about it. But if you don't accept that AstraZeneca does, when it clearly does, then maybe you can't give me advice on that.
Absolutely. You know what, Omar, you're entitled to ask these questions, and I really appreciate you doing that. And I think for everyone's benefit in terms of education, I'm not sure if everyone knows what we're talking about when we say fetal cell line. This is why I'm saying that we'd like to put together a response for everyone to benefit from, and that can be shared out. That's all I'm suggesting. Thank you for that.
There is another question in the chat by Sister Server, our brother. Is there any other way to improve our immunity?
So really the best way to improve your immunity is really to lead a healthy lifestyle. That's the only way to boost your immunity. People talk about different things, but really eating healthy, eating more vegetables and fruits and white meat and fish, more of a Mediterranean diet, and exercising regularly. There is no other shortcut to improving your immunity other than those. You can, if you don't have a balanced diet, you can take multivitamins and stuff, but other than that, there is no other medication or anything else that would help improve your immunity.
Okay, I think Fariha has a question, so please go ahead.
Hello and assalamu alaikum. Thank you for the beautiful session, and there's a lot of information, alhamdulillah, we received. So my question is, me and my family, we never got a flu shot. The reason is because my daughter is allergic to eggs. So the reason that's why she cannot have vaccine for a flu. That's why I was just wondering, like, is there any way, like, she is able to get those and then so we will, or like, what is it good for whoever is allergic to eggs?
So egg allergy is not a contraindication to this vaccination because it does not have any components that are derived from eggs. So you can get this vaccine safely. So if you can, even if people who can't get the flu shot because of egg allergy, they can get this vaccine.
Okay, next we have Rihanna.
Yeah. Hi, everyone. So can you hear me?
Yes.
My question is just regarding the ethics, regarding how the trials have been performed and where they're from, because it's very scary and very uncomfortable hearing that after some people have taken the vaccine, like there are still cases of, probably like, like the blood clots you said, I read about it, that's all in the news. So how are these trials being done? Who are those people that have been tried on? Like just want to know what the ethics and how it has been. Just clarify that.
So a lot of data is coming out right now, and you're right. Like, for example, AstraZeneca, we just got the information about the blood clot. The thing that I tell everyone is that Health Canada is really vigilant about all kind of information. Getting a drug approved in Canada is not an easier way. When they do approve the drug, they actually look at every aspect, and that's why Health Canada has issued the thing about AstraZeneca, and they are recommended not to. Yeah. So some of the data is available about who were the participants, where those trials that happened, but those trials that happened in different parts of the world. Some happen in US, some happen in UK, some happen there was one in Brazil, there was one in Spain. So they are happening all over the world because it's a global pandemic. It's not happening on one region, it's happening all over. So the trials are happening everywhere. The thing that I tell people that gives us some relief as Canadian is that Health Canada actually does really good due diligence before they approve any medication. And that's why it took longer for Canada to get those vaccines as compared to our neighbor US, right? People in US, already a lot of people are getting vaccinated. And I put my phone in my jacket. So I didn't. Sorry, yeah. So because of that Health Canada process, I tell people that you should be relieved about the stuff that they are doing their due diligence, and the vaccines that we are getting are going through their process of checking all the ethics requirement for those clinical trials.
The other thing I would like to add on is that right now we're actually going through these kind of live results that so many millions of people have been vaccinated across the world, and we are hardly seeing any side effects from these medications. So the fact that Canada is kind of lagging behind a little bit in terms of in the immunization process is actually beneficial in the fact that we know much more data from this phase 4, as we call it, of the trials, which is the actual immunization of large scale populations with hardly any side effects right now.
Okay, I have another question in the chat box from Sister Fatima, and it is about that she has iron allergy. Is she eligible to get vaccine?
Yep, it does not contain anything that has related with the iron. So if you have allergy to iron, it should not stop you. There is no contraindication for that.
Assalamu alaikum. My name is Mohammed Dar. I have a question. I have been raising my hand for the last 10 minutes.
Sorry, I couldn't see your hand, brother. Go ahead, please.
Well, my video has been stopped and for a long time, so that's why maybe.
So sorry for that. Please go ahead.
So that's okay. First of all, thank you very much, for holding this session. I really appreciate. Just to correct it, that the wait between the doses is not 3 months. It is 4 months. Okay, like Sadaf said, 3 months. No, it's 4 months. So I'm really concerned too. Like what I heard that maybe in between it's too long. What do you think about that?
So like we and Shazia, I think me and Shazia have spoke about it a few times, that the reason the doses, the time between 2 doses was the decision that made so a bigger population can get vaccinated. And now they are also considering if you are in that high risk group, that between the 2 doses, the gap would not be that long. So they will give you a dose closer to that gap. But just because they want to have a bigger population immunized as compared to having just one group of people who get 2 doses and then rest will be without doses. So the 2 dose, you will still have after receiving the first dose, you will still have the immunity. So it's not that your immunity is not going, the second dose is actually going to boost that immunity. So if you are in that high risk group, where you have, I believe it's 65 and older, and then people who have comorbid medical conditions, they are actually reducing the gap between the two doses.
That's coming down the pipeline. Oh, it's not active yet, but they're planning on that. And as vaccines get more available, this is a dynamic number. They will shorten the duration if they're able to, for sure.
Oh, so they will let us know if they shorten it? Okay.
Yep, they will let you know.
Thank you very much. Thank you.
I also got a question through WhatsApp that is, when people are booking, are they able to ask like which vaccine are they getting, or do they have?
No, they don't have a choice. Even as a vaccinator, I've been working at vaccine clinics, and as a vaccinator, when I reach there, that is the day when I find out what lot is available in the vaccine clinic that day.
Okay, so we were holding our own members, MWC members, for the end. So anybody, if you have any question, we have last 5 minutes.
Fawzia, there is a question in the chat that I'll read it. I just recently suffered a heart attack and got a stent in one of the arteries, wondering if qualify for priority list. My age is 58.
So not right now. The current priority list that I has listed, it only includes people who are receiving like chemotherapy, who have end-stage renal disease, or who've had a stem cell transplant or organ transplant. So those are the highest risk category. People who have underlying heart disease, diabetes, hypertension, or chronic lung disease, these would be again considered a high-risk category, but they would be coming up soon, but not right now. So just be on the lookout as the priority group changes. These would be in a priority group, but they're not in a priority group at this point. If you're 58, then you're almost eligible to get the vaccine anyways, because the 60+ group has already started today. But the underlying heart condition group would be a priority group, but not at this point.
Okay, there is another question. Would the COVID-19 vaccine and variant vaccine be same?
We don't know. The variants that are coming up, they are they are doing clinical trials to see if the vaccine would be effective in the other variants. So far, there is no data that I can say that they have come up and they have declared it, but we will see. I think one of the participants has listed a website that's showing about the injections that are the side effect, reactions. I just want to let people know that any websites that has .com on the end are not the websites that are usually recommended by the healthcare providers, because they are not the websites that are authenticated. If you need any information about COVID or COVID-related adverse effect or COVID-related disease, or any, and not even COVID-related, any other disease related, look for the website that ends at .org or ends at .ca or .gov.ca, because those are the websites that are properly monitored, and the data from those websites is actually much more factual than anything which is .com. So I just want to let people know, just for an educational point, if you need any information about those things, maybe try to find the websites that are more authentic.
That's authentic, by the way. It's from the CDC. It pulls the data API right from the CDC. People can look at themselves.
So one really good website that I would recommend, it's called Up to Date. It is meant for clinicians, but it does have a patient portion as well that is free, that you don't have to subscribe to. So if you have any questions, it has a Q&A for patients. So it's the name of the website is Up to Date. It looks into all the studies and updates it constantly.
Okay, one more last question is about the booking. Can people book through their doctors as well? And we are also hearing that some pharmacies and Shoppers Drug Mart, they're doing it. So what is the procedure of booking over there?
So right now, in terms of doctors' offices, it varies from office to office. Like for our family health team, we have kind of said that if somebody is calling for help, they should not be turned away, that try and help them and pre-register them if they're having issues. But we can't have everybody call the doctor's office to pre-register. The phone line would be really overwhelmed. But if somebody needs help and they're having a hard time, they can for sure call the doctor's office, and most doctor's offices would be willing to help them pre-register. I am not too sure about pharmacies. I haven't heard of pharmacies helping with the pre-registration process. I don't know if anybody else has heard.
So Shoppers Drug Mart is doing in Toronto and a couple of other areas in Ontario. They are doing their vaccines, which is walk-in, I believe. You can call and book an appointment, but we haven't got anything in the southwestern region. So nothing in the Waterloo or Cambridge. We still waiting. I think there are 350 pharmacies who got approved for vaccine administration by the end of April. So once that will roll out, then we will have more information if they want you to just go as a walk-in or if they want you to book an appointment.
And I'm saying for the last three questions, the last question, but this is related to this. So if we are talking in terms of pharmacies or other private sectors thing, so can people from Waterloo Region go to Toronto or some other region and get their vaccine there? No, they have to book it here?
Yeah, you have to have your address in that area.
Oh, okay. So I think that's pretty much it, and we are right on time.
Just one last comment. I think a question came up about what vaccine types are we using at our clinics. Right now, I would say most of the the big sites that we showed you on that list is all Pfizer. We're using Moderna in smaller places, like in our mobile clinics, because Moderna can travel more easily. But those like Pine Bush and the Boardwalk, it's all Pfizer right now. That's our steady supply of vaccine is Pfizer right now. And again, that may change with what happens with AstraZeneca going forward. But at this point in time in the region, it's mostly Pfizer for all of those sites, and then Moderna for some of the mobile clinics that are going to look maybe potentially like a different site. Like we had a pop-up clinic for people experiencing homelessness. They were using Moderna there, right, where they were traveling to places to give injections. So that I just want to clarify that one last piece of information.
Also, Fauziya, if you could let our audience know that there are more sessions like this coming up, because it's past 8 o'clock already and it's prayer time. So if you could let them know where to look for more sessions like this in regards with COVID, vaccination information.
Yeah, we're actually planning more sessions. We're trying to find a way to advertise that more broadly through the region's website. I would say check in with the COVID-19 vaccine information page. We're linking most information from there. More sessions that we do book will let ABIHA know and other community partners know that they can share this information. But we are booking more of these sessions coming. So keep your ear out and I'll do my best to get that information out. But your best bet is to check in with the COVID-19 vaccine page, and we'll link all information through there. Oh, and also if you follow the region on social media, so whether that's Facebook or Twitter, a lot of information is posted through the region in that way.
So I thank you all. First of all, the panelists, thank you so much for giving your important time and inform us and answer so many questions. And then I would thank all the community members who attended. And that was basically the purpose of this session was to play our role. Get informed, make your well-informed decision and play your role and be a part of healthy community. Thank you, everyone, and good evening.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you.
Thank you. Allah Hafiz.
Thank you. Bye-bye.
Thank you very much.